about prognosis? So patients want to know what their prognosis is going to be. And one thing I think we always have to think about is that prognosis is variable, especially in these rare disorders. We don't understand the whole clinical spectrum for most of them. The prognosis may also be mutation specific. There'll be significant uncertainty even within families. There can be variation to the age of onset of end-stage kidney disease, for example. A very important point is for diseases, say PKD1, that may be diagnosed in childhood, and it may not affect the patient and lead to chronic kidney failure till they're 20 or till they're 30 or 40. And so there may be 20 years between the time that they're diagnosed and they really need treatment for the disease. And just think how much things have changed over the last 20 years. And so in the same way going forward, so the disease that patients experience, their parents experience now, or other patients will be different than the experience that they may have. I'm just overwhelmed, so happy to have heard about the new experiences with the pig kidney transplant, even though they were just a short term just to see if it might work. But these are things that are really going to be in our future and really help our patients. And I think we always need to give our patients hope that there is help on the way. Is there a treatment? Clinicaltrials.gov is a great place to go and type in the gene mutation, and that should help you to find if there are therapies. But again, I think you'll have to really look at the literature, find out about observational studies like ours that have tried different medications. And then we have to think about other accepted therapies. Are they good therapies for our patients? With a REN mutation, you would not use ACE inhibitors, but with other mutations, they might be helpful. SGLT2 inhibitors, they could also be helpful. In general, patients want to be more aggressive with therapy than their doctors, and so they really want the treatment. A lot of patients try dietary therapy, and dietary therapy may be helpful, especially low protein or heart-healthy diets. The one thing I disapprove of is treatments that are potentially dangerous or that could decrease the quality of life for patients. So for example, I would not want my patient with, say, a REN mutation to be placed on an all-seafood diet, especially if the child doesn't like seafood and everybody else in the family is having a regular diet, right? So that would be a diet that we don't even have an idea if it would be helpful. And so we don't want our children, our patients, to suffer from the disease because they're getting some type of unproven treatment that's making them suffer. Genetic counseling is really, really important. And fortunately, gene panel companies provide counseling which is helpful to both the doctor and to the patient. And I just think it's imperative that we take advantage of these opportunities. I know at different places, genetic counselors are in short supply, and so we really need to have access to counseling from these providers. One thing I found that's very important is when we do testing for the disease, we'll often test and find an unaffected individual. And it's always important to let these unaffected individuals know that there is not a chance of passing the disease on. A lot of times people think, well, maybe the disease will skip a generation. And so if someone doesn't have any mutations in a causative gene in their family, we really need to make sure they know that. We don't want to test minors for diseases that occur in adulthood. And testing for potential donors is a major reason to make a genetic diagnosis. But again, when you're trying to decide on genetic testing for other family members, I think getting genetic counselors involved is incredibly helpful.